Thank you. So good afternoon. Jane King, Head of Security and Site Services at Guy's and St Thomas's NHS Foundation Trust, colleague of Mercedes, who was on the previous panel. Guy's St Thomas's comprises of 6 major London hospitals across London, 25,000 staff, and all of the problems that the previous panel mentioned.
Hi everyone, nice to be here. My name's Claire. I head up our work at the Equality and Human Rights Commission focused on guidance, advice and training for employers in complying with their legal responsibilities under the Equality and Human Rights Act.
Hi, I'm Penny East. I'm the Chief Exec of the Fawcett Society, which is a women's rights organisation founded 150 years ago by a literal suffragette. So take that history and heritage very seriously. But yeah, we're a members-led organisation and we root out misogyny and sexism throughout society.
Good afternoon. I'm Christine Fells. I'm Business Development and Partnership Growth Manager at the Susie Lampley Trust. So I head the commercial team. We work with various organisations across all sector, no matter where they are on their personal safety journey, whether it's updating their policies or whether it's organising training.
Thank you so much. I think you all agree what a fantastic diverse range of panellists we've got. I'll go to the other side, don't worry. If I could just start at this side, Jane, and this is a question actually for all of our panellists. Also, we're thinking about prevention here in the workplace and best practice solutions. So there's 2 parts to this. What are the most effective approaches you've seen to preventing violence and aggression and harassment in frontline workplaces? And are there examples where workplace culture has shifted successfully to reduce that aggression and harassment that you can think of?
Thanks for picking me first. I think it's difficult because a lot of the work that we are doing, to be honest, is reactive. And we are constantly on the stream, but obviously we're trying to take out of that some positivities about we have one foot forward in front of the others. I think the work that we have done, so people spoke earlier about policies and procedures, and what you need to make sure is that they're living documents and not documents on the shelf gathering dust, and staff have to have awareness of them and easy access. So we have a page on the internet with all the links to all the documents. One of the things that we have done is we look at those documents and are they sitting in the right place? And it was mentioned earlier, so the lone worker policy has been moved from my page, from security and my responsibility, to the trust, health and safety, and sits under the Chief People Officer. And I think that's absolutely right. It should do, because then it has a different governance reporting line. So that's looking at things. Is it working where it is? Do we need to do something? So we quite like that. One of the things we have done at Guy's and Thomas is we've set up what's called Supporting Positive Behaviours Group, and that is trust-wide. And we learn from what's going on. So every Tuesday, Mercedes comes to the office. We look at predominantly A&E, but also it's ISM, specialist medicine. What has gone over the last week? What do we need to do? Is it, so you have civil sanctions, you have criminal sanctions. Is it straightforward criminal sanction under the Emergency Workers Bill that we call Operation Cavell? And are we going to take action? We will pursue and make sure the police do that. Or is it civil sanctions? And our warning and exclusion policy says that we will do what's called acknowledgement responsibilities agreements. We will write to the person and say about their behaviour and the effect it's had on our member of staff. So that's the 2 streams that we do. That is then closing the loop and telling staff about what we can do and hopefully supporting them. And then, as it was said earlier, we have psychologists, support, etc. For me, the biggest thing is that we have the policies, we have the reporting structure. Are we getting the information that we need off those reporting systems? And actually, does it give us the right information? Are we closing the loop with doing the action? Are we then feeding that back to the member of staff to know action's being taken, but also they have the support that they need for the next day coming into work? And I can't remember the second part of the question.
Have you seen examples where
Yeah.
you've seen that cultural shift?
I think for us, the supporting positive behaviours is a real leap forward, because that's us engaging with our staff. And we're not saying one size fits all, because what works in the children's hospital won't be the same as what you need in A&E, won't be the same as what you need in cancer and surgery. So we work with those individual clinical groups about how we work with those staff and those patients together.
Fantastic. Thank you, Jane. Same question.
Yeah, thank you. So I would say our 8-step guide is the one that has the most practical steps for people to follow. In terms of the 8 steps, they're things like training that we've mentioned previously. What I would say on training is preferably not e-learning, preferably face-to-face training and tailored to different levels. So the training that you give to your managers will be different and will need to include things like what to do when a complaint is made. So that's just a note on training. Engagement with staff, so really thinking about the forums that you have, your staff networks, utilising those, your one-to-ones, all different types of engagement with staff as well. What to do when a complaint is made. So there was a mention earlier about making sure that complaints are dealt with quickly, but also in a time-sensitive manner, and that people are kept up to date throughout. Third-party harassment, which has also been touched on. I think that's a sticking point for a lot of employees. It's a new challenge, I think, for them to be able to really think about that and how to make it preventative steps. You've also got things about reporting mechanisms. That's really critical, as was mentioned in the previous panel, making sure that people feel confident to report. Thinking about your risk assessment, it's going to be really difficult, I think, to demonstrate compliance with the new duty if you don't have a risk assessment in place. Other things to think about, evaluation of your steps. So I think a lot of employers tend to take those steps, but don't necessarily evaluate and take time to stop and think about what's been effective, what hasn't, what might need to change. And then your policies as well, which are always integral, making sure that you're updating those. So those are probably some of the practical steps. Where I've seen that work well is when people have done all of them and done them meaningfully and not just done tick box approach to training, for example. I also think that I've seen examples where people might do all of those steps, but they don't think about the third-party harassment bit. If you don't think about the third-party harassment bit, you will be in breach, even if you've updated all of your policies, you've done your training, you've engaged your staff, you've done all of those other steps. So really just thinking about all 8. And then just another heads up, if you're looking for more examples, I would recommend heading over to our technical guidance, which is on our website. It is very technical, which is why we created the 8-step guide as a more practical resource. But if you're looking for examples on what compliance could look like, but also where you might fall down, then I would recommend heading over to our technical guidance, because there are some great case studies in there as well.
Thank you, Claire. Some really helpful tips. Thanks, Penny. Same question.
Thanks so much. So at Fawcett, we developed a sexual harassment toolkit, which takes you through 5 steps, which is very much mirroring the things that you've already heard this morning around culture, policy, training, reporting, and then action being taken as a result of that reporting. I guess the one thing I would pull out is around culture, and this has been touched on before, but seeing culture in the round, so looking at your wider work around equality and diversity and inclusion and not seeing them as siloed off, because actually how women in particular are able to show up to work and feel like they're being treated safely and with dignity, that's key. So whether there's sexual harassment kind of actively going on or not, kind of a woman's feeling of how she is treated at work will be crucial to whether she can disclose if it does happen. Where I have seen it done effectively, I think it's really around leadership being vocal. So I know of one high street bank, for example, where a very senior, I don't even know the titles in a bank, so president, vice president, I don't know. But they did it, there was a couple of them, both a woman and a man, and I think they kind of had an awareness week around sexual harassment and around violence against women and girls. And both of them kind of disclosed things that had happened to them either in their personal life or in previous employment. And of course, it's not necessarily about people disclosing things that they're not comfortable disclosing, but I think that crucial message was that this can happen to anybody, and it's not just something that, and it's not something that happens to certain people or in certain workplaces or in certain communities, and that by leaders who have a lot of respect in workplaces stepping up and talking about their own personal experiences, I think reduces the stigma and shame around that. Because one thing you see a lot is that women and girls don't want to disclose because of that stigma and shame, but also because they're worried about things that might happen to their career. And I guess that's another thing that's really important to keep an eye on. It's not just about disclosing and there being a response. It's also about what happens to that woman's career afterwards. I remember recently going to a conference and hearing about a woman talking about her experience in the Met Police, for example, and she was listened to and there was a response, but her career then was essentially hampered and held back, and she was moved from projects that she'd been really enjoying. She was moved from teams she'd been really enjoying. There was promotions that she was passed up again and again, and in the end she ended up leaving. There has to be a really robust mechanism to making sure that even if the process and policy is being followed by the letter, that there isn't a cultural shift around a woman's career. And whether that's actual or perceived is really important, because it may be that a woman feels there is a perception that her career will be negatively impacted. So it's not just so much to have a process or a policy written on SharePoint and that it needs to be cultural. The woman needs to genuinely feel that her career will not be negatively impacted, and that she will not only be heard and listened to, but then she will be able to pursue her career aspirations afterwards. Thanks.
Thanks, Penny. That's a really important point, I think, around the cultural shifts that sometimes we don't consider fully. And Christine, the same question to you.
So I totally agree with the previous panelists. I think there's been a lot of focus at compliance. And yes, that definitely is a starting point. But I think we need to move beyond compliance and have that proactive approach. And that ties into what they've been saying, the culture, the workplace culture, what is acceptable behavior and what is not acceptable, both in terms of employees as well as those third-party harassers, and all the steps that employers need to take. So I think definitely a starting point is moving away from that compliance to that proactive approach, looking at what can be done. So looking at, first of all, leadership buy-in. It's really important that it's not a tick box exercise, that the employees see that the leadership really buy into this and really want this to happen, are on board and are leading this program and this pathway. And then also seeing the practical aspects, sort of thing of how we can make this happen within the workplace. So I think it's also important, you mentioned about e-learning, and I think building on that, and e-learning can be an option for large organizations where there are logistical challenges, but it's about how relevant is it? It's, have you really understood the employee risk profile? The type of work that your employees are doing and the type of challenges that they may encounter as part of the day-to-day. So that's why we really think it's important to have that training needs analysis to really understand the challenges that employees may encounter, so that all the procedures, policies that you put in place, the risk assessments that you put in place are formulated based on those actual circumstances that your employees are facing, because that's when it's relevant to them. That's when they feel they're being cared for in that aspect. So then the upskilling of employees, giving them that training, sort of thing, again, with examples of scenarios that they are going to encounter as part of their day. That's when it feels relevant to them. The reporting, we talked about reporting, making it easy to report, and also encouraging those near misses. Nothing happened, but we don't know what might have happened another time. And if you're in that situation again, or a colleague is in that situation, it's important that management know. How can they set procedures and give guidance if they don't know? So that having that easy communication, reporting systems is really important. And obviously what's done following the report, that they feel they were listened to. I think that's really important as well.
Thanks, Christine. And I think that really touches on the point that we've discussed this morning around the patterns of behaviour, those near misses, nothing happened. But the point of it is building a picture, is building a pattern. We've seen that in Gracie Spink's case. And if that was taken more seriously, there may have been different actions that were taken. Just sticking with the cultural shift piece, actually, can I come back to you, Penny, if I might? How can organisations measure the effectiveness of these interventions and ensure they are embedded into that sort of workplace culture? Because it's one thing, as you say, writing a policy and doing things, but how can we actually measure that and ensure it's effective?
Yeah, of course. So I think the first thing for any employer, whether you're large or small, is to understand that what we're talking about is a societal issue. I think quite often you hear employers, maybe not, think that it's not an issue that affects them. In fact, I'm thinking back to a talk I once did about violence against women and girls at a law firm, and had a very well-meaning partner come up to me afterwards and say, very interesting, not something we have here. So I think that is the first thing, is whether it's big, small, whether it's predominantly men, minority, that we are talking about societal attitudes towards women and girls. And unfortunately, without getting too kind of negative, the kind of attitudes around misogyny and towards women and girls is unfortunately getting worse. There's a lot of evidence to show that unfortunately public attitudes are worsening in that. So the first thing is to have a really kind of honest appraisal that if you are working for them, there is a chance that that kind of misogynistic attitudes and sexist attitudes will have a kind of interplay within your working environment. In terms of kind of the effectiveness and kind of measuring whether the policies that you've got are actually working, I think it's important to have open communication channels. I think it's important to do kind of cultural audits, not in reaction to things going wrong, but instead kind of at a timely point to be able to check in whether people feel able to disclose, whether people feel like they have an understanding of what the policies are. Do they know who their manager is? So you hear sometimes that they don't. Do you know who to go to if you can't go to your manager? I mean, we just did a recent report specifically looking at architecture, as it's got huge problems with women leaving, the 50-50 split within architecture education, but then you look within 5 years, thousands of them are leaving. So we were looking into the analysis of why women leave. And actually, a lot of it is about the fact that sexual harassment is a huge interplay. And within those things, you have firms where are very small and they have no policies around this stuff. They have no surveys. And because they're small and started by founders, they don't have any of that kind of comprehensive robust report mechanisms. So I think it's really important that you can do these kind of climate surveys and cultural audits, whether you're big, whether you're small, and also to consider using independent support with that as well, so that you stay away from marking your own homework. If you've got a cultural issue within your organisation, people even filling in a survey are going to be a bit resistant to sharing. So I think it's really important that you consider also using independent facilitators as well.
Thank you. That's really helpful. And I think that perspective is really useful for employers to bear in mind. This is a societal issue that is no doubt going to affect, given the prevalence of it, every aspect of our lives, and taking it from that perspective rather than a personal perspective will help us to tackle it. Claire, can I come to you, please? Sort of staying with the sort of practical implementation of these legal frameworks, how can organisations practically implement these legal frameworks to reduce violence and harassment?
Yeah, so I'd refer back to the 8 steps that I outlined earlier. And in terms of noticing whether they are making a difference as well, it's a little bit about what Penny just touched on, but I think looking at your data, often you'll have managers ask people within one-to-one settings, which is fine if you've got a trusted relationship, but people might not feel comfortable. But looking at your quantitative data as well, so looking at your retention rates, your progression rates. As you mentioned, the case of the woman who left the Met Police, was there an exit interview? Was there a chance for her to feedback on that? And really digging into the data that organisations have, as well as some of those staff engagement forums, I think is important as a way of recognising whether the steps and the 8 steps that I outlined are really making a difference.
Thank you, Claire. Jane, again, sticking sort of with that cultural theme, obviously done a huge amount of work at Guy's and at Thomas's. How do you foster a culture where staff feel empowered to actually report the incidents and feel confident that action will be taken?
It's a toolbox. Of course, it's not one thing is going to help. I think it's about the openness and transparency. Totally agree. The culture has to be led from senior leadership, and senior leadership has to be more than just a tick box. And they have to say that this is actually what we're going to do. And our trust has recently sent out an anti-racism message signed by the board. But also it's about engaging with the local teams, and we do have staff networks. We also engage really closely with our staff side, all of our unions. So there are various formats where concerns can be raised. We have speaking up ambassadors also. So yeah, people can do it via one-to-one if they feel comfortable, but there are other resources available. And interesting enough, one of the avenues where we do receive information is because my team deliver the Trust's training, conflict resolution training, and people will talk to my trainers afterwards and say, I want to tell you about this situation. Does that sound right? and what could I have done. So actually we're getting intelligence from areas. We will then have a look at what areas it's working. We will speak to someone very senior and say, are you aware of this in your area? And then we can work with them on that. So it is just about intelligence gathering from whatever resources, but it's about giving staff the confidence to know that if someone says something, we will look into it and we will pass it. A lot of the times the Speaking Up Champions is probably one of the better formats. And then, of course, you have the HR avenues available to staff as well.
I mean, it's brilliant that you've been able to foster that environment where people are able to share that intelligence, because that's it, isn't it? It's building a picture, and it's an evolving process. We're not going to get this right the first time. Christine, can I come to you? So we're right to pass the mic down. How important is it to implement preventative measures beforehand and not just wait for an incident to happen?
The short answer would be very important. To be honest with you, if we take a step back, I think with personal safety, sometimes we're a little bit behind when we look at health and safety. There are things which are part of our day-to-day activities nowadays in terms of hazards and trips and ways we can injure ourselves. And even if you look at fire safety, we had the fire test today, the chance of being in a fire are low, but we still take steps so that people know what to do. People know how to prevent and what action to take. So they don't freeze. They know how to look after themselves. And the same principle should apply for personal safety in that respect. What can we do and how can we have that sort of forward-looking aspect in terms of our personal safety?
Thank you. This is a bit of an open question to everybody, touching on that sort of training reporting. How can training reporting and support systems be designed to meet the needs of different sectors? So obviously we're talking about today retail, hospitality, healthcare, transport, while being sort of scalable and sustainable. Maybe Penny first, if that I might.
Well, one thing I'll just say on the reporting part of it, and I think that we have heard a lot about reporting and the importance of action, and some really horrific cases where action hasn't been taken, and that when a woman discloses, if action doesn't result, that the likelihood of her disclosing is so reduced because that trust has gone. But I think in terms of the report mechanism, it's important to think about the training and resources for the people that might have those reports being made to them. It's not easy acting on those reports. And actually, I think when you think about cultural shift, you think about empathetic, supportive workplaces that listen to people. Actually, it's quite a different skill set to then respond to a disclosure and to make sure to the point about zero tolerance. Those are not easy conversations to have. And particularly if you're talking to somebody who is a serial perpetrator of sexual harassment, which unfortunately we've heard a couple of cases about that today, they are likely to be highly coercive and manipulative in their response as well. And so it's not simple. It's not simple for the person that has that disclosure to be able to know how to navigate it. So I think it's really important that there is sufficient training and resource put in to making sure that the people that might be hearing those disclosures know how to respond, and that they also have support. But it's not something you can presume that people can just do easily. They're tough conversations and they're very difficult, toxic dynamics to be navigated.
That's a really important point. And as you say, that coercion, that control, that manipulation is far too often is what we see taking place, and employers taking the wrong action because perpetrators can be quite convincing. And I guess what I'd say to the room is absolutely training is so pivotal. But as you've heard this morning, there is a lot of support out there from the Fawcett Society. We've heard of the advice line, obviously, at Rights of Women, Susie Lamplugh Trust. Please get in touch with us. We have training programs. We can support and help work with colleagues, because those are absolutely difficult conversations to navigate, but we need to have those conversations. Thanks.
Yeah, and I would say equally in terms of trauma-informed approaches when dealing with people who are bringing a report to you, I think it's going to be a difficult process to do that. Lots of people we know don't report. So if someone has built up the courage to, I think that it's important that people are trained in trauma-informed responses as well, and that there are designated people within the organisation that are trained specifically in that. You talked about different sectors and scalable. One of the things that the Commission also has is toolkits and checklists for the hospitality industry, because we know that's a particular area where there is significant levels of violence against women and girls and harassment. So we've put together a checklist of things to do before, during then after a shift. So if you work in hospitality or also the music industry, I would recommend going to check those out as well. It gives advice and tips on things to do in terms of communicating with staff, reminding them at specific points, who is around to report things to, what harassment looks like. Surprisingly, not all staff know what harassment looks like, and what to look out for, and what to do if and when they see that occur. So just a flag on those checklists as well.
That's really helpful. Thank you. And Jane?
So obviously agree with my colleagues. I think for me as well, though, it's about the communication message, and it's about us telling staff this is what we can do, and being very open about it and saying when something happens, this is how we will deal with it. These are the avenues of support. And we, at the moment, we are just looking at doing a new staff campaign, and it will be about openness. And that will be internal as well as external. You need to tell the local media about what we are doing as an organisation. Just touching on training, colleagues have mentioned, but training needs analysis, particularly for all the disciplines in our organisation, because one size isn't going to fit all. And then making sure the training that we have is appropriate for those staff. And it is different levels for different staff. And so we have a very tiered approach. Myself and Mercedes are looking at trauma-informed care, both from the patient and the staff perspective. And we are just on the cusp of doing something around restorative justice and just trying to look at another avenue for supporting our staff that have been involved in incidents. And we're hoping that also will open the message about people and behaviours.
Brilliant. Thank you so much. I can't believe we're actually at time, because I think we could probably keep going for quite a while here. I just want to say a huge thank you, Jane, Claire, Penny, Christine. Such a wealth of knowledge here. And obviously we're going to have a lunch break shortly, and hopefully you'll be around and colleagues can pick your brains a bit more just on the fantastic practice we've seen, advice and tools that we've all discussed this morning. A huge thank you and really appreciate your time.